Regarding the oxidase positive gram negative bacilli, we have Pseudomonas aeruginosa, Pseudomonas aeruginosa. Very typical, very much tested, very frequently tested in the boards. So Pseudomonas has first the known facts are Pseudomonas is gram negative bacilli, non lactose fermenter but oxidase positive. So Pseudomonas has a mnemonic in Pseudomonas itself. So P for there is a pneumonia, especially the chronic pneumonia in the cystic fibrosis by its capsule, because of its capsule. Then for the S we have the sepsis, and sepsis in especially the burnt patient, and also the neutropenic hospitalized patients. Then we have E for there is a rash, a necrotic cutaneous lesion, Caithema gangrenosum, which is a rapidly progressive necrotic gangrene, mean necrotic lesion, especially in the immunocompromised, hospitalized neutropenic patients. For urinary tract infection, cystitis, pyelonephritis, and especially the hospitalized catheter indwelling catheters individuals which are neutropenic, again immunocompromised and catheter induced, but it is less common than E. coli. So one of the causes of UTI. Then D for diabetic patients are very much prone to Pseudomonas infection, and especially the otitis externa, malignant otitis externa, and which is external ear inflammation, very painful, and the diabetics are very much prone to otitis externa. Also the swimmers got this otitis externa. For M is the structure for this Pseudomonas, so mucoid polysaccharide capsule, because of which it can cause chronic pneumonia and cystic fibrosis. Then we have O for osteomyelitis, one of the causes of osteomyelitis. N, nosocomial infections. Nosocomial mean catheter or the hospital equipment, ventilator equipment induce infection, nosocomial infection. Then A for the addicts, less common, drug abusers, and also the S for the skin itchy pruritic rash known as hot tub folliculitis. So regarding another mnemonic, PEEP, for the PEEP we have the P for phospholipase C, which degrade cell membrane and included and lists in the virulence factors of this Pseudomonas. E for endotoxin, which can causes sepsis and fever. Then we have the exotoxin, and this exotoxin is like diphtheria. It inhibits elongation factor 2, leads to replication, translation, transcription impairment. Then P for pyoverdin, and cyanin, and which can generate reactive oxygen species and causes infection. Regarding the treatment of choice, first we give anti-pseudomonal beta lactamase inhibitor, piperacillin, and tazobactam. Then we give a third and fourth generation cefepime and ceftazidime, and then we give quinolones, and also we give carbapenem monobactams. After this, general information regarding Pseudomonas is catalase positivity. That's why it can cause infection, especially immunodeficient patient. It is also oxidase positive, gram negative, lactose negative. It has grape-like odor, and also it is motile, and most frequently it is found in water, especially the pool water and also swimming tubs. So most commonly it is present over there. It is motile and it is aerobic. So this is all about the Pseudomonas. Generally brief discussion about the Pseudomonas. Like Pseudomonas, we have a small but common bacteria which is also gram negative, lactase negative, but oxidase positive also, that is catalase positive, and the bacteria is Burkholderi cepacia. It can causes pneumonia in cystic fibrotic patient, and it is also MDR, and in immunodeficient catalase positive causes immunodeficient patient prone, makes immunodeficient patient prone, and also there is a relative contraindication. In that relative infection of this bacteria, relative contraindicated in patient with lung transplant because of the poor outcome. So this is all about the oxidase positive gram negative bacteria.